Hi, Dr. Eric Thomas here. Just had a patient in the office I had to speak calmly to and explain what was going on during a procedure we were about to do. There's nothing life-threatening in this situation, but anytime we remove a mole, bothersome little skin tag even, many people are pretty threatened, and we explain carefully. We do it so frequently that sometimes I think we lose perspective on how upsetting it is for people to have someone come near them with a sharp instrument. As they should be, of course, it's survival. So I just thought I would take a moment to talk about what happens when you come in the office and we recommend some, procedure, some removal, some surgery. First of all, yes, there is a consent form. Sorry, there's a consent form for everything. We still have to do it in a very correct way. It's not to get us off the hook. It's just so that you're informed about the realistic small chance of a scar or infection. And also, pretty obvious, but that because we do not process the tissue, the laboratory will send a bill to your insurance company. So after that's out of the way, we then explain, look, there are ways to help reduce any discomfort a lot. The discomfort's often far less than the fear of it. Many times I've taken things off, and people who have been procrastinating for quite a while will say, gee, I wish I'd done that before because it was really nothing. You mean it's over already? Wow, all those years. 10 minutes, it's done. Now, it isn't always that way. Of course, there are procedures and there are procedures. But at any event, before we do anything, we, of course, clean the area, make sure everything's nice and sterile. But then we use lidocaine, call it Novocaine, whatever you like, that has been partially neutralized to reduce its burning quality. See, lidocaine is kept in a somewhat acid or lemon juice type state. I believe it's just so to last in storage for a few years. But guess what? Lemon juice stings. So by partially reducing the acidity, and yes, then we have to get rid of it in a week or so, but that's not a problem. By partially reducing the acidity, it stings maybe 10% as much as it otherwise would. True, we have to get it under the skin, so we blithely just say, a needle. And I think in people's imagination, they see this 6-inch long, extraordinarily big needle. So this is the very needle that I actually showed to this person to demonstrate that it's extremely small. Now, granted, it's a needle, but sometimes we can pinch the skin a bit. Sometimes we can put something cold on it. Yes, we have a numbing cream. It doesn't work as well as when used by your dentist inside the mouth because there's more of a barrier to penetration, this skin versus the inside of your mouth. But anyway, this is a 30-gauge needle. I don't know if you can even see it. It's pretty tiny. It's smaller than a pin. And yes, of course, it's still sharp. But sometimes we could even put it in through a follicle, and in that case, it stings very little, if at all. In any event, one way or the other, once it's numbed, it takes a few seconds. The area is completely numb. Yeah, you might feel some pushing or pulling, but there should be nothing sharp or uncomfortable. And yes, it should not hurt. If it's extremely deep, there might be a little tenderness, but generally speaking, there is no discomfort after the Novocaine wears off in half an hour to an hour. Some offices have to use adrenaline, or epinephrine we call it, to reduce bleeding. Dentists usually use it, I believe, because they have no direct control. It's rare in our office to use adrenaline or epinephrine mixed with the lidocaine because sometimes that can produce a feeling of anxiety. So be aware the epinephrine-free is in the U.S. a blue label and the other is a red label. So if your doctor does not need the red label, you're better off as far as anxiety goes with the blue label. Nevertheless, there are procedures that do require epinephrine be mixed with the lidocaine, and by no means is that a reason you should not have it done, or by any means a criticism of those who use it. So we remove the lesion with or without sutures, whatever is appropriate. We put on a dressing, and that varies a bit depending on location, whether it's bleeding, and so forth. We do give you wound care directions. We have a one-on wound care, and while we also have written directions, you'd think that one set of directions would fit everyone. But if you listen to the wound care direction, you might see that it's not quite as simple. Depends on whether it was a clean or contaminated, traumatic, sutures, no sutures, location. But that's not the purpose of this video. This video is just to tell you that we are sensitive to your concerns, and hope that this helps you understand a little bit better about what goes on in the office. Best wishes. Thanks for listening. Eric Thomas.